Thank you so much for the support that you've shown this organization and to me personally in this past year. It's been a very, very busy, a 24/7 busy kind of year, but it's been a wonderful year. Now, a year ago when I proudly accepted this position, I told you that the theme, the agenda, the challenge of my presidency would be taking advantage of change. With the passage of the Affordable Care Act just 1 month earlier, with nonstop threats to our Medicare payments, with the prospect of a very nasty 2011 session in the Texas Legislature, there was no question what kind of change we were talking about. But I also told you that if any medical society is prepared to help its members through these seismic changes, through advocacy, education, and engagement, it's our Texas Medical Association. And I pledged that TMA would help Texas physicians take advantage of this change all around us. So here we are a year later, and I can report that we've come a long way, but we still have a long way to go. I can tell you we've done so much, but there is still so much to do. So let me give you a quick rundown issue by issue of how we've been able to take advantage of change and of how much more remains for all of us to do. Well, let's start with the most massive change of all, the 20,000+ page health reform law. That law says physicians should be more efficient and effective in our practices. Well, okay, fine, we're for that, but what's the best way to get from here to there? We started by educating physicians online, in person, at conferences and seminars, and on massive conference calls about what changes the Affordable Care Act was bringing and how they would affect their particular practice type. Our health reform schools drew record crowds at County Medical Society meetings, and we even were invited to give a health reform school as far away as Connecticut. The concept caught on like wildfire, and other states have been emulating it. And our task force on accountable care organizations, led by Dr. Asa Lockhart, put together a series of guidelines to help us make sense of these brand new health delivery systems, whatever they are, and act both here in Austin, in Washington, to make sure that physicians, not insurance companies, not hospital administrators, but physicians would be in charge of ACOs. We're monitoring the zillions of new regulations coming out of the Obama administration and teaching physicians how to pick, install, and meaningfully use electronic health records so you can earn the bonuses you deserve from Medicare or Medicaid. We're helping physicians measure your own quality of care so you have data to fight back when the bureaucrats say that you're not doing a good job. And all the while, we're working with our friends in Congress to fix the bad parts of the bill, keep the good parts, and put back in what they left out. All of these must be ongoing priorities for TMA if we're going to help our members survive and thrive in this new healthcare landscape. And speaking of something that was left out of the healthcare law, how about the disaster that is Medicare funding? Congressman Mike Burgess says last year was the worst year ever for physicians in the Medicare program. And that statement comes as no surprise to anyone in this room. 5 times the feds threatened to cut our Medicare payments by nearly 25%. Twice those cuts actually went through, and Washington did us the favor of not paying us at all for 6 weeks, rather than send us 2 separate sets of checks. Wasn't that nice? In December, Congress unanimously voted to freeze rates again for all of 2011. We urged the House and Senate not to wait until November of this year to enact a permanent solution. And we kept up the political pressure. Last week, a key House committee actually started work on a new payment formula. And the chairman of that committee actually told the press what we've been saying for years and years. Quote, if the pending 29.4% fee cuts are allowed to go into effect, a large number of doctors will be forced out of Medicare, and a large number of beneficiaries will lose access to care. We've been telling them that over and over and over again, and it appears that the message is finally starting to get through. We've got to keep telling them over and over and over again so that we can get a permanent fix done this year. Now, the challenge is to keep this political momentum going and actually enact real change before the cuts are once again hanging over our heads. Now, meanwhile, back in Austin, the Texas Legislature is not yet finished with a frequently sad and dangerous session for physicians and our patients. Now, depending on how the budget mess gets sorted out, Medicaid, mental health, public health, and undergraduate and graduate medical education will take big, big hits. Our job will be to document and demonstrate the devastation that may follow something so nothing like this ever happens again. And what I see as slavish allegiance to a social agenda that led our lawmakers to pass laws telling physicians how to practice medicine without regard to science, without regard to our learned judgment of what's best for our patients. We've been able to keep a lot of bad bills bottled up, but others have unfortunately already made it to the governor's desk. But I can't end on these sad notes. I want to leave you with one more example of how we've been able to take advantage of change for the better for our profession and for our patients. We came into this legislative session knowing that Texas hospitals seemed to think that putting physicians on the payroll was the magic solution to all of their problems. It would attract doctors to underserved rural communities and urban areas. It would allow hospital administrators to control all the money, and in the process, control how we care for our patients. Well, we rolled with those punches and came out on top. We took advantage of that change. Hospitals want to employ physicians? Okay, but you'll do it by our rules. And those rules say that doctors and our patients, not hospital administrators, make the decisions that count. Those rules say that physicians' clinical judgment rules the day. Those rules say that medical staff oversight will guarantee the clinical autonomy of physicians, whether they're employed or not. Those rules say that physicians are in charge of all clinical matters, from bylaws to credentialing to utilization review and peer review. And those rules say that it happens whether you're in a 501A or whether you're directly employed by that particular hospital. These are landmark reforms that I think will give us the strongest physician protections in the country. But what it comes down to is this: we are allowing the employment of physicians, but we are not allowing the corporate practice of medicine. Unlike other states that allow employment of physicians, Texas is different. Thank goodness. We're one of the first states to pass statutory clinical protections for physicians who choose employment. Now, one of our bills pertaining to small rural hospitals has already passed the House and Senate and is waiting for Governor Perry's signature as we speak. 3 others, written with the help and cooperation of Bexar, El Paso, and Harris County Medical Societies, have each passed at least one of the chambers. Now, they allow hospital districts in those counties to hire physicians, but only for their legal mandate of treating the indigent. And all 3 of those bills have protections for those physicians involved. So finally, here's the real prize. Thousands of Texas physicians are already employed by hospital-controlled 501A organizations. And this was something that I personally heard as a big problem from physicians in my travels across the state. Invariably, I would get pulled aside. Dr. Bailey, you've got to know what's happening in our community. I'm a member of this 501A, and the hospital is running roughshod over us and abusing their authority. Well, let me tell you, when Senate Bill 1661 passes, and it's almost there, those thousands of Texas physicians who are employed by or contract with the 501As will now practice with those same protections for clinical autonomy and independent medical judgment that we included in the other bills. I want to commend the Council on Legislation, its chair, Dr. Dan McCoy, and our great lobby staff for this masterful body of work. They took advantage of change. Please join me in thanking them for their hard work. Employment without protection is the corporate practice of medicine. Employment with protections is part of the practice of medicine, and that's what we stand for. Well, my time in this job is almost up. It's been a pleasure to be able to tell you that we've done so much, but still have so much to do. On each of these fronts, on health system reform and Medicare, on the state budget and scope of practice and the Texas Medical Board and protections for employed physicians, we still have so much to do. Dr. Bruce Malone and the incoming team have a lot on their plate. They still have so many opportunities, though, to take advantage of change. But you've heard this before, Bruce can't do it alone. Our wonderful TMA Board of Trustees and the councils and our amazing TMA staff can't do it alone. They'll need help from every single one of us and our friends and our colleagues back home. Are you ready to continue the fight for our patients and our profession? Are you ready to follow Bruce into the fray? I need a commitment here. If you're committed to being part of the next great chapter in the great Texas Medical Association, raise your hand. Come on, raise them high. Well, now, better yet, if you're committed to helping Bruce Malone take advantage of change for all of us and all that we do, stand up right now. I want to see you.
Does that mean the people in the back have to sit down?
Now, that's a commitment that I believe in. So, Bruce, I've done all that I can. My leg of this relay race is ending, and it's time to pass the baton on to you. I do it with thanks to all of the support that I've had from Tarrant County Medical Society, from the amazing and unequaled TMA staff, from the TMA Board of Trustees, this wonderful House of Delegates, my wonderful family and sweet husband, Doug, and everyone here in this room. Thank you, and good luck.